I was 5 months pregnant, so I was having the symptoms of being feeling nausea and weakness. So I went to the health facility. I was diagnosed of pneumonia, and after that, taking the pneumonia medications, I went for a full blood count test, and I was diagnosed of TB. So it wasn't easy when I was diagnosed of TB. I even felt bad for myself. So I have to let them know that this the condition that I'm in. So my husband didn't accept it, having a TB at that time. So it was a lot. I have to go through a lot. Seeing like a woman getting TB, you have to household chores. Who was going to do those house chores with children too around? So I have to embrace all those things and move to my parents' place so that I can take my medications well to recover. Yeah, so all those process, and I have to it led to divorce because I was diagnosed of TB, which people see that it's not curable, it's an evil disease, as they say.
Back 2017, 2018, I was infected with TB. Not easy. I went through a lot, stress, stigmatization and discrimination. We realized I was growing lean day in, day out. So that's where it comes in that we should visit the health facility to check out whether we've tried for the spiritual and it's not working. So when it comes to physical, if we can add something out of it. So we approach to the hospital. By then, that's where we got out to know I'm suffering from TB.
Somewhere 2013, I felt sick, and it started like a malaria or fever. So I went to the drugstore and bought medicine. After that, I went to the drugstore and bought medicine to cure myself, but still there was no change. So I decided to go to the hospital. When I went to the hospital, I've been given treatment, but it couldn't work. So all of a sudden, then I started coughing. So I went back to the hospital again, and they gave me another medicine, but still, it wasn't okay. So I went about 3 times, and finally, they told me that I should go and try herbal medicine. I grew lean. In fact, I became like a walking skeleton on the street. So in the community, they mock me. Some are calling me Kofi Kowu, some say Ochinobewu, some say it is, but I don't mind because I know that I will survive.
Minya yare number 49 years. 49 years. She become my wife change. She become wife in channel. And officers will say, doctors will say, and this idea, my wife in change there. Omeba Abet testing my wife. To move by my wife for her, and name in Koran. Abet that was no winner, and she's only a real. She started set with my family. My family don't know, not a day. My moving in our world, not day. Jimmy D. Tsunami fa. The 2 weeks beyond my back checkup.
My journey started in 2014 when I was in JHS, and I started feeling very ill, and it was so serious until I was diagnosed of suspectable TB. So then I started medication. The treatment was 6 months. So after the 6 months medication, 3 months later I went back to school because I was about to write BEC, and then it came back again. And then it was MDR tuberculosis. That was a very hell. And then everything was down. The journey started from there. I started coughing out blood. I was not able to work well, and I have to defer my education. At 2017, I wrote BEC whilst I was on hospital bed. I couldn't go to SHS. I was eager to go to SHS, but I couldn't go due to the sickness. And I stayed home till 2019. I wrote BEC again. I went back to SHS. And now I am a university student. So I would say TB mellowed me, but now I have gained back the passion and I've gained back the audacity to stand for people living with TB.
When I was tested at Korle Bu, they told me that my condition is not normal TB, but MDR. So they will place me on drugs and injection for 2 years. And through the drugs, I was survived. Then I have the hope that other people too will survive.
9 months. See, the woman no much change yet. The woman no much change. Go no much stop. Said no way. Go so no much. 7 months. Now, no, the bar hospital no. Me did put to buy. Now me back check up. The horse na. The doctor said, "Let him go."
So we didn't disclose it to anyone. We kept it in between ourselves. By then, I wasn't going out. I was kept in the room. Sometimes I come out to take fresh air and then return back to the room. But my family members didn't stigmatize me. Once I'm part of the family, they took me very well and they took care of me so that I can have my life back.
My wife dear, only one me try. This year, many as with you. Kura me no. Dia ba ko e wo training college. Afi ba ko so ko university, ba ko so tepa. Abusunya je me fefe.
Yes, for my family, they did very well. My mother was the treatment supporter, and my dad was already there financing everything. My siblings also took me in so well. According to the health workers, they counseled my parents that they should get me a separate room. They should even wash my clothes with gloves, like separate everything. But since my parents couldn't do that, they had to take me in. They did everything just as I am, and now I am fine now.
Oh, I was unaware, so they will take me to water region. And I process, I say no, I will not go. So they thought I was possessing. And then they gave me an option. Either I will go or I will leave the house. And I told them I'm not going. So in fact, they kicked me out of the house. And I was on the street going up and down in the community.
My firstborn is in her SHS first year, so I would advise them to continue taking their drugs. They have to go to the facility when they see signs of cough. Not always cough is linked to TB, but they have to go to the health facility to be screened, to be tested. If they have the disease, it's not any death warrant disease, it's curable. You have to go through the phase, take your medications as prescribed, and you'll be okay.
We did a lot of impact work, and I remember one student from one of the SHS was also a TB patient. The teachers got to know about it and they sacked him from boarding house. But through my advocacy, he was able to go back to school, and now he is also a graduate of SHS. So I did a lot and I impacted so many lives. People who were not able to continue the medication, I was able to speak to them, share my story to them, for them to come out as successful people.
I have to sacrifice and then move to other facilities to help my colleagues. And I'm working under Tema Metro, that's Tema Newtown, Ashaiman. For now, when you go to Tema General Hospital and you ask of Morris in Richmond, you can find me there. And since I started till now, I've able to enroll, getting to 100 people on treatment.
I don't work only at Weja community because TB is everywhere, TB anywhere. So I go around like ambassador. And then by God's grace, some people started sponsoring me. I go to the radio stations and then TV stations to talk about TB. So I got many clients.
Ashanti bakwai. Ipa 18 there. Na hu say omo nyina dia duru so omo nyina ye kama. Ye ba hu say what test positive ya. They make sure say o ye never tro duru so. Na ye tunufu. We nso so omo nyina duru e kama.
during my advocacy, I got to know is a lot of people are facing financial problems, especially when it comes to the nutritional fact. A lot of people are complaining that the medication is hard, and it's true. Taking the TB medication without nutritional fact is something terrible. Sometimes people would like to take the medication, but the food and the things that they will have to take in before taking the medication is a problem. So people have stopped taking the medication due to the nutritional support they are not getting. So I will urge people in Ghana, I will urge the government to help finance TB so that everybody will get access to better health care through nutrition. Yeah, this is what I would say.
Back on a long journey, and for what we have gone through, we have to educate a lot so that people will be aware of the disease, that it's real and it's curable. It's not a death warrant disease. They will be cured if only they have the mindset and are willing to take their medications. Everything will be fine with them.
Medication continuously as prescribed for you, you'll be cured. And we want to urge the whole Ghana and the whole world that TB is curable. When someone comes to you and the person says, oh, TB is not curable, it's a spiritual disease, tell the person Morrison Richmond said once on the media that TB is curable.
Okay, I plead with the government that TB is a faster killer than HIV or other sicknesses. So we beg the government to invest more money in TB programs.
I'm urging the government that we are begging them. TB is a key thing that everybody should pay attention to. It can affect everybody. It can affect the elite. It can affect the illiterate. Everybody. So not for people, but for everybody. So let's all come in support. Build and support TB very well so that everybody will be free. Just like as we did for COVID-19, we should all invest in TB so that we can end TB by 2030. Everything should be done.
They will not see a bono. I buy my pint, no first can ship a man and you for no, and yet journalist for no. No more good devil. And yes, sir, get to bed 10 years going. Yentimi Sano.
We have the cured persons, and we have the health workers, we have the media. Each and every one of us has a unique role to play in fighting against TB. It was insightful to know and share the stories of people who have been affected and the kind of challenges they faced. First, with the sickness itself, with the treatment, and with social challenges associated with the disease. It is incumbent on us to use platforms like this, volunteers, champions, and personalities like this, to share these experiences widely across the country, because we believe that there are many people living with TB who have not yet been detected. And it is our collective responsibility to come together and search for these people. So the government, through health institutions, is instituting screening activities for TB cases at our outpatient departments. We also have, from time to time, hotspot screenings, that is, intensified screening in places that we think prevalence is high. We look at high-risk groups like persons living in confinements and prisons. Even among health workers who are high-risk groups, we target them for screening activities. And we are finding the cases, but we are not meeting the expected target. And it is our duty to come together and see how we can improve on that. The Global Fund, that was a major source of most of our activities, has reduced and reprioritized the fund, and there is a deficit, which the government has given indication of helping us to cover. And priority is given to essential commodities like medicines, testing cartridges, X-ray diagnostic tools that we need to find the TB cases. So that is where the government is also coming in to help, in addition to the general health infrastructure and human resource that the government pays for us to work.
you.